Hello everyone, it's my pleasure to be here. This is my first time using a microphone ever. So I usually yell because when you work with seniors, you have this big voice. My sons always say I'm yelling, but I'm not, I'm just talking loudly. So like Pastor Tony said, we're going to talk about brain health today. And 30 years ago when I started out, we didn't know there was such a thing as brain health. We didn't know that there was ways of preventing certain forms of dementia. So how exciting that I get to be a part of it and you get to be a part of it. And what a turnout. This is one of the biggest groups I've ever spoken to in the past 2 years. So good for you. That's amazing. That's really great. So welcome everyone. And as Tony said, the last 9 years I worked with what's called Behavior Support Ontario. Every long-term care home has one of those people that helps support people who have dementia, who may be having challenges or difficulties, as well as the caregivers, the PSWs, etc. So that's my area that I love. So today we're going to talk about healthy life, healthy brain. I just put that in a very simple form. We're going to look at the things that we can do to keep our brain healthy and hopefully avoid getting a form of dementia. We'll do a very brief dementia overview. Sometimes there's a bit of confusion about dementia, what it really means, what's the difference between Alzheimer's, memory loss, and dementia. So we'll talk about that. And then we'll talk about what you might want to think about if you are worried. So some of the signs and symptoms, and I'm going to make them very realistic to your everyday life so that you'll really have a good understanding of what is worrisome and what's not. Okay? And then I'll just touch on some of the programs and services that are available at the Alzheimer's Society of Toronto. We are the Toronto chapter, just for your information. So I have a quiz for you. I am not a doctor. This is not an assessment, but it's a memory game. Later on in the presentation, I'm going to ask you to recall these images. So what do we see on the screen? A flower, a glass of water, the sky or clouds, a chair, a clock, and a bird. I'm going to give you 1 minute to memorize them in the way that you memorize things. Don't write them down. I saw that. Don't take a picture. Memorize them in your brain. Okay, again, it's not a test. It's just a fun game. Okay, moving forward. I have a question for you. I am forgetting things, and that must mean I have Alzheimer's disease or dementia because I'm older now. What do you think? Yes or no? Oh, we have a great group here today. Resounding no from all of you, so that's great. Another question. Are there things I can do to keep my brain healthy? I kind of gave you the answer, didn't I? Yes. Yes, I forgot to take that one away today. All right, so dementia, just as an overview, it describes a set of symptoms, and we're going to talk about those symptoms, very common symptoms that you see in most people who have dementia. But Alzheimer's disease is a form of dementia. It's one of the types of dementia. They think there's up to 300 types of dementia. Okay, but let's look at this umbrella here. I like to actually label the red umbrella dementia. So the name of the umbrella is dementia, and the raindrops that are falling from that umbrella each have their own type of dementia. Alzheimer's disease is the most common. That's the one you're probably the most familiar with. Alzheimer's disease accounts for 60 to 80% of all the dementias, right? And worldwide, not just here, worldwide. So the second most common is vascular dementia. And that's the series of small strokes you might have heard about. They're called TIAs or trans-ischemic attack. So here's the good news. Vascular dementia is on the decrease because it's very preventable. And that's what we're going to talk about today. So we're educating people in their younger years on how to prevent it. So it's on the decrease. Unfortunately, Alzheimer's disease is on the increase. Can anyone think of why that might be? People are living longer. Well said. Exactly. So the number one factor that's non-modifiable, you cannot change it, you can't do anything about it, is age. Right? So 1 in 3 over 85 will get Alzheimer's disease. 1 in 10 under 85. So that's quite a dramatic difference. And we're an aging society. The baby boomers are aging, so we're seeing more and more of it. We're also better able to diagnose it earlier on now, which is a great thing because there's a lot you can do when you get an early diagnosis. There's a lot of medications available that really slow down the process. So it's important to get a very early diagnosis. But I want you to think about dementia as the umbrella, and underneath it is the types of dementia. I've also worked a lot with people who have young onset dementia, but that's very uncommon. It's only about 1% of all cases. Frontal temporal dementia and Lewy body dementia. If you know someone who has dementia, it's very important to find out what type of dementia they have. And the reason for that is because they'll have different signs and symptoms. So memory loss is what presents first with Alzheimer's disease, and I'm sure you're familiar with that. But with the other types of dementia, it's often changes in personality that come first. So if someone came to you and they said to you, oh my gosh, my mom, she has cancer, I'm so upset, you would say, well, what type of cancer does she have? So cancer is the umbrella, and underneath it is bone cancer, colon cancer. That's the same with dementia. So does that make sense to everyone? Yes, perfect. All right, so let's look at some of the things we're going to talk about this afternoon. We're going to talk about some of the decisions and the choices that we make that can reduce our chance of getting dementia. We're going to talk about challenging yourself. We're going to talk about being socially active. So everyone being here this afternoon, you're already ahead of the game. This is great to see you all out together. Eating well, we'll talk specifically about a brain healthy diet and what that looks like. Being physically active, I can't wait to talk about that one. There's good news. Looking at stress in your life, protecting your head. I'm just going to touch on that one now. We know that because of concussion, 95% of retired football players in the US have dementia. So I'm not going to show you a separate slide. Yes, 95%. Someone just said 95. So I really don't want my sons playing football. So protecting your head, and how we can protect our head at our age is to make sure we don't fall, right? We don't want to have concussions. So make sure our homes are safe and that we can avoid falling. That's the number one way to keep your head safe. And then making healthy choices and volunteering. I don't have a separate slide for that, but volunteering actually produces endorphins that help your brain make connections. So it's a super great way to avoid getting dementia. So let's look closely at being physically active. So who in this room exercises regularly? Put up your hand. Oh, that's quite a bit actually. The last group I was at downtown, it was about 3 out of 60. So you're doing very well.
Does walk classify as exercise?
Yes, walking is the number one exercise we like to recommend for reducing your chances of getting dementia. So that's a very, very good question. Yes, walking, absolutely. If you walk for 40 minutes a day, 5 days a week, you reduce your chance of getting dementia by 40%. So yes, walking is super important, okay? Just to give you an idea. So the thing about exercise is that it reduces your chance of heart disease, stroke, obesity, and diabetes. All of those things can contribute to that type of dementia I talked about, vascular dementia, the one that's on the decrease. And it's also needing to be sustained, varied, and regular. So you want to do not just walking, but maybe lifting some gentle weights or using the ropes. I'm sure that some of you attend some of the exercise classes within the village, and that's very useful. And something you enjoy. Again, those endorphins are being released if you enjoy it.